and he just has a really calming, beautiful effect on. He's just a little magic baby.
Meet 5-year-old Sebastian, whose family calls him Bash. Kristen O'Brien and her husband adopted Bash after first bringing him into their family as a foster child.
He was on oxygen, thyroid condition, heart condition, brain anomalies, many things, medically complex and developmentally delayed.
O'Brien learned Bash has an extremely rare genetic disorder called CAT6B. When the O'Briens picked him up from Children's Mercy Hospital in Kansas City, he was just 6 months old.
When we are at this major hospital in Kansas City, and I said to the doctors, so, how many patients with this have you treated? And they said, we've never met a child with this. I'm in a room with 8 specialists, and they say this to me. So everything about this has been not what we anticipated, but it's been the right move at all times.
Bash was automatically enrolled in Medicaid through the foster care system and has remained enrolled since the O'Briens fully adopted him.
Medicaid is a lifeline to him. It gets him what he needs to be alive.
A lifeline that helps the family pay for most of Bash's health care, including more than 6 different types of therapy and 60 hours of in-home nursing care each week.
He's got like 18 or 19 specialists, probably the last time I counted. There might be more on the list now.
Who Bash is able to see because Medicaid pays for it. But the future is uncertain. Congress is debating the One Big Beautiful Bill Act, which includes sweeping changes to the Medicaid program. The most substantial are new work requirements for able-bodied Medicaid enrollees between the ages of 18 and 64 to work or volunteer for at least 80 hours per month. There are exceptions to this, including people with serious medical conditions and dependent children, which should include the O'Briens. But that doesn't mean these new changes won't affect them.
There's a lot of red tape. And enrollment's just the one step to get coverage on any item that he requests is a whole process. It's not just doctor's appointments and therapies. We have to go through multiple durable medical equipments, DME companies, to receive the equipment that he needs, a specialized chair to be able to sit at the table and practice eating, any mobility device, special things to help him hold a toothbrush, and special things to help him eat.
All things the O'Briens have to individually apply for in order for Medicaid to help pay for it. These new work requirements also include mandatory verification of employment twice a year. That means more administrative work on top of what can already be an overwhelming amount of it.
All I'm seeing out there is talk of adding more paperwork, and I'm like, where are you going to put these papers? On whose desk?
About 8% more people rely on Medicaid in rural Missouri communities than urban ones, meaning rural hospitals usually see more Medicaid patients. As Congress debates potential cuts to the program in President Trump's spending bill, we conclude our closer look at Medicaid in Missouri and Herman to find out how this could affect small-town Missouri.
Oh, it would be untenable.
Bill Hellebush is the CEO of the Herman Area District Hospital. It's a critical access hospital, which means it receives additional Medicaid assistance designated for rural hospitals. Hellebush says about 10% of the patients who visit his hospital are enrolled in Medicaid, which is less than most rural hospitals in the state. He's concerned about the burden the hospital in Herman and other small towns might have to bear if people lose Medicaid coverage.
For everyone that loses health care, if they need to be seen or their child needs to be seen, they're going to take their child or themselves to the nearest ER. So we're still going to see those patients. We don't turn them out in the cold. It's just that already stretched critical access hospitals like ourselves, we're going to shoulder that burden because we will see those patients for sure.
Federal law requires hospitals to see people during emergencies, but if they lose insurance and can't pay, the hospital often absorbs the costs. This is particularly concerning for rural hospitals in Missouri, as research shows nearly 1 in 5 are at risk of immediate closure. Hellebush explained the Herman Area District Hospital was operating at annual losses of $1.6 million. He says operations are improving, but even a 1% reduction in payments could be devastating.
Critical access hospitals have been closing for the last couple decades because we don't really have the support system or the network enjoyed by a lot of PPS systems. And you don't have the buffer to absorb any financial hits to your book. Any.
Hellebush says people would have to travel about 80 miles to find the next nearest emergency room if his closed, which could be the difference between life and death.